Welcome back, my people. Still discussing about the complications that arise as a result of vomiting. We have discussed the first one, the second one, and now we are in the third one, whereby we will start by discussing damage to the enamel or the coating of your teeth. And before we continue, guys, let me appreciate you for making me part of your family. It's all because of your support that this channel is growing each and every day. If it were not for you guys, this channel could not be where it is at the moment. So I always appreciate your support and pray God that He may continue blessing you people to continue benefiting from this channel and pushing the content so that it may reach the whole community as a whole, because our aim is to educate you people. For those who have not subscribed, make sure you hit the subscription button, put the notification bell on so that whenever I make or produce any video, YouTube will automatically notify you and you will never miss any content from us. Let's get back to our topic. Damage to enamel of the teeth. I know most of us are wondering, how does vomiting cause damage to enamel of our teeth? And in this video, you are going to get the true picture on how vomiting damages your teeth. So, damage to the teeth, to the enamel of the teeth, is commonly seen in people suffering from bulimia nervosa. We discussed about this topic some days ago, and those who have been following my content know what bulimia simply means. But for those who have not been following, I can remind you what bulimia nervosa means. So, damage to enamel of the teeth is commonly seen in people suffering from bulimia nervosa who induce vomiting, not vomiting spontaneously. They just make themselves vomit. So who induce vomiting on a regular basis as part of their illness. So what is bulimia nervosa? Bulimia nervosa simply means a eating disorder characterized by binge eating or eating large amounts of food in a short duration of time, followed by purging or fasting and excessive concern with body shape and weight. I hope you get this very clear, though a bit complicated. Bulimia nervosa simply means a eating disorder characterized by binge eating or eating large amounts of food in a short duration or a short while, followed by purging or fasting and excessive concern with the body shape and weight. And what does binge eating mean? Binge eating means eating large amounts of food in a short amount of time or duration. Binge eating means eating large amounts of food in a short amount of time or duration. And what does purging means? Purging means attempts to get rid of consumed food done by vomiting or taking laxatives. Purging means an attempt to get rid of consumed food done by vomiting or taking laxatives. So, the acid content after inducing vomiting from the stomach comes into contact with enamel of your teeth and erodes it and damages the teeth. So the damage comes as a result of inducing the vomiting, whereby the vomiters comes out with the acid content from the stomach, whereby, as we know, Our stomach has a lot of acids that assist in digestion of our food, or the food we eat. We have the hydrochloric acid, the bile, so the mixture of all that, when it comes out, when you induce vomiting, it's always harmful to your teeth because it corrodes the enamel, erodes it, and damages the teeth. That's how vomiting can interfere with your teeth. I hope you get the answer now. So, the digestive enzymes in vomit or vomiters also damages gums, which leads to dental complications. The digestive enzymes in vomiters also damages the gums, which leads to dental complications. The fourth and the last complication of vomiting is what we call tear of the esophageal mucosa. Tear of the esophageal mucosa, also termed as Mallory waste. It's also tear of the esophageal mucosa is also termed as, or also called Mallory waste. Mallory waste tear, and occurs due to profuse vomiting that tears the inner mucosal walls of the esophagus. Let me repeat this. Tear of the esophageal mucosa, also known as Mallory waste tear, and occurs due to profuse vomiting that tears the inner mucosal walls of the esophagus. This manifests as reddish streaks of fresh blood in the vomit content. That marks the end of our discussion. It has been a bit long, the discussion about vomiting, but I hope those who have been following me have known what vomiting is and what it entails, and the remedies, home remedies you can apply to stop vomiting without necessarily using drugs. And also, when home remedies fails, we also discussed about the medications you can use to prevent or protect vomiting. So, we are going to have an overview of another topic which people have been pushing me hard to discuss on, and which is common in the society. So we will just have the introduction part of it, the types, and then we will continue with it tomorrow. And this is diarrhea. In most cases, when you have vomiting, it might be accompanied by diarrhea, depending on the cause. For example, in food poisoning, you will have vomiting and also diarrhea. So let's discuss diarrhea itself as a topic and know what diarrhea is and what it entails and the types. So diarrhea refers to typically loose watery stools and increased urge or need to have a bowel movement multiple times a day. Diarrhea refers to typically loose watery stools and increased urge or need to have a bowel movement multiple times a day. Diarrhea can be acute or chronic. Acute means instant or abrupt, while chronic means it has been there for a while. So it can be acute or chronic. That means two types of diarrhea are acute and chronic. So acute diarrhea occurs when the conditions lasts for 1 to 2 days. Acute diarrhea occurs when the condition lasts for 1 to 2 days. You might experience diarrhea due to a viral or bacterial infection acquired via something you have eaten or drunk. So acute diarrhea may be viral or bacterial and may be as a result of something you have drunk or eaten. Chronic diarrhea occurs when you have diarrhea on most days for longer than 3 to 4 weeks. Most days for longer than 3 to 4 weeks. And the common causes include irritable bowel syndrome or IBS. Number 2, inflammatory bowel disease. Or number 3, condition. Number 3, celiac disease that affects absorption of certain diseases. I hope you get this. It might be caused by inflammatory bowel disease, irritable bowel syndrome, or a condition, for example, celiac disease that affect absorption of certain diseases. So this marks the end of our discussion today, whereby we have ended our discussion about vomiting and commenced a new chapter about diarrhea. So in our next topic, we will start by discussing the causes of diarrhea in depth. And I hope people, or you guys, you are going to get a better view of diarrhea the way you have been requesting. So let's always keep locked. And thank you for your time. Let's continue subscribing, liking, and sharing our content so that it may be recommended all over the world. And our channel may still continue growing bigger and bigger. Let's meet in the next video. And have a good evening.